Hello, I'm RN Hayes. We're going to do a sterile room for dressing change and we're going to put on sterile gloves. But before we get started, I want to state three goals of wound care. One is to remove necrotic tissue to promote healing. Two is prevent and eliminate and control infection. Three is absorb drainage and maintain wound environment. Also, we want to differentiate between clean, clean contaminated, and contaminated. Clean describes an unaffected operating wound in which no inflammation is encountered, respiratory or unaffected urinary tract is not entered. Clean contaminated describes an operating wound in which the respiratory, alimentary, and urinary tract is entered under controlled conditions without unusual contamination. And contamination is fresh accidental wounds as well as operations with major breaks in the sterile field or gross spillage from the gastrointestinal tract and incisions which are acute. And the sterile technique, sterile is generally defined as meaning free from microorganisms as opposed to clean. Clean means free of dirt, marks, or stains. Clean technique involves strategies used in patient care or to reduce the overall number of microorganisms to prevent or reduce the risk of transmission of microorganisms. Next thing I'm going to do is set up my field, sterile field. When I open this away from me with one flap. I handle the edges. And this is my clean field. I'd opened my package. These are the supplies I'm going to use. Also want to put on my gloves. I'll use the outer edges. I have my gloves on. The equipment we're going to use for sterile dressing change is sterile gloves, mask, gown, and disposable retractive dressings. First thing I'm going to do is check the physician orders before I even get started to do all of this. Before my hand hygiene, before I start this process, I would gather all of my equipment. I would provide privacy for the patient. I would clean off the table or bed that I'm using. I would place supplies over a sterile field. I would fold linen to expose the incision area. I would place a soiled bag or dressing under the incision. This is a bag under the incision. I would cover the client with a blanket or sheet, open a sterile package, and a tape. Now, this right here is my patient. I had removed the tape or the gauze. I had disposed of it in the trash. Once I have disposed of all the dressings, put it in the trash. I'd already cut off tape. I'm sorry, I would clean the incision area with sterile swabs. Sorry about that. I would clean the incision with sterile swabs. I would paste the pad over it. After I do that, I will remove my gloves. Place tape over it. And I would discard all my materials. Thank you.